Hey guys, welcome back to the channel. Today, we're diving into something super serious but super important, how open heart surgery is actually done. Yeah, I know, it sounds scary, it sounds intense, but trust me, once you understand the steps, it all makes a lot more sense. So sit tight, relax, and let's walk through this life-saving procedure in simple, easy language. What exactly is open heart surgery? Open heart surgery is a big-time medical operation where doctors open up your chest to work directly on your heart. This can be for fixing blocked arteries, repairing valves, or sometimes replacing parts that aren't working right. It's serious business, but it saves thousands of lives every year across the world. Step 1, Getting ready, anesthesia. Alright, step 1, the patient is brought into the operating room and given general anesthesia. This means they're completely asleep, pain-free, and won't feel a thing. The doctors check the heartbeat, oxygen level, blood pressure, everything has to be perfect before they begin. Step 2, Opening the chest. Once the patient is fully asleep, the surgeon makes a cut down the middle of the chest. Then they gently open the ribcage to reach the heart. Sounds wild, I know, but these doctors do this every day. They are trained like crazy for this moment. Step 3, Heart-lung machine. Here's where things get kinda cool, the heart is connected to a heart-lung machine. This machine keeps the blood pumping and oxygen flowing while the surgeon works. It basically acts like an artificial heart and lungs. This gives the doctor a still, steady heart to fix. Step 4, the actual fixing. Now this is the real deal. Depending on what's wrong, the surgeon may bypass blocked arteries by attaching a new blood vessel so blood can flow better. Repair or replace a heart valve. Fix a hole in the heart. Replace damaged parts. This part can take hours. The surgeon works super slowly, super carefully, every move matters. It's literally precision at the highest level. Step 5, Restarting the heart. Once the repair is done, it's time to bring the heart back into action. The surgeon removes the patient from the heart-lung machine, and the heart starts beating on its own again. Sometimes they use a tiny electric shock to wake it up, kinda like jump-starting a car. Step 6, Closing everything up. Now the ribcage is closed back together, usually with strong metal wires. Then the chest is stitched up carefully. The patient is moved to the ICU for monitoring. Nurses and doctors keep a close eye on them for the next 24 to 48 hours. And boom, that's how open heart surgery is done. It's intense, it's complicated, but it's one of the most amazing medical procedures humans have ever mastered. If you found this video helpful, make sure to hit that like button, drop a comment, and subscribe for more awesome, easy-to-understand explanations. Thanks for watching, and stay healthy, folks.